Okay, good morning, good afternoon, good evening, everybody. My name is Vince Blazer, and I am the director of the Immunization Advocates Program at the Sabin Vaccine Institute. And so on behalf of Sabin and the Nursing Now Challenge Global Solutions Initiative, really glad you all could join us today to talk about some of the experiences nurses and midwives are having with vaccines and vaccine equity and acceptance, and really look forward to hearing from a lot of nurses and midwives today, and also sharing a little bit more information for those of you who missed our first launch webinar earlier this month on a new challenge that we have in partnership with Nursing Now and Nursing Now Challenge and Sabin for some storytelling and advocacy training for nurses and midwives. So before we dive in with our nurses' stories, Professor Lisa Bayless-Platt, who's the program director for Nursing Now Challenge, is here. Lisa, do you want to say a couple words of welcome before we get going?
Well, I just want to say hello, everybody, and how exciting it is to be here with such a formidable panel that we've got. And many thanks, Vince, to you and the Sabin Institute for really promoting vaccine equity and access. Really excited about the next hour and a half that we spend together. And don't forget, audience, if you've got questions that you want to put into the box, please do. And because there'll be opportunities for us to answer them. And I'm really looking forward to what we're all going to learn. Thanks, Vince.
Thanks, Lisa. Great, really appreciate it. Okay, great. So I'm going to share my, my slides here. So just bear with me 1 second. Okay. Okay, so as Lisa just noted, first throughout the time that we're having here, if you have questions for any of the nurses and midwives who are speaking today, or you have questions for staff at Sabin or the Nursing Now Global Solutions Initiative on the challenge, please go ahead and put those in the Q&A section. You can also respond and engage, continue the discussion of what we're going to be talking about today through the chat function, and please do, click on everyone and introduce yourself in the chat function. Okay, so apologies, these are the same slides for those of you who may have joined us on the 10th, but we know there are a lot of folks who weren't able to make that. So the first question that we're asked is why we're doing this, why we're doing a challenge on vaccines and immunization. Obviously, given what's happening in the world today, given the various stages of rollout of COVID-19 vaccines, on its face, that's obvious, but why nurses and storytelling for nurses and midwives particular on this issue? Well, despite the huge toll with nurses and midwives being majority health service providers and caregivers around the world, and the enormous toll in terms of lives lost, over 115,000 health workers have died, and that is likely an underestimate. And the huge mental and physical toll that the workforce continues to face in dealing with not just with COVID-19, but all the residual effects of this pandemic. Health workers are still not adequately given global priority of global COVID-19 vaccinations. We've seen many countries prioritize the health workforce in the rollout, but yet as of July, still only about 1 in 8 health workers had been fully vaccinated, WHO had estimated. And so, health workers should not be expected to sacrifice their safety in order to serve their patients. And so obviously prioritizing health workers in COVID-19 vaccine rollout is paramount around the world. We've also, in terms of when vaccines are available and conversations with patients and with communities, we are seeing a lot of this misinformation and disinformation, and the impact that it's having not just on COVID-19 vaccine rollout, but on nurses and midwives and other health workers' ability to continue to deliver high vaccination rates for mothers, children, the routine immunizations. WHO and UNICEF just reported last month a huge dip in 2020, and likely going to continue in 2021 in some of these routine immunizations. And so that plays into what's happening currently and potentially what's happening in the future. So the stories of how that is playing out in your communities is extremely important to understand for policymakers. And we on the flip side, we've seen some major commitments made by the G7 high-income country leaders made to health workforce in the context of global vaccine rollout. And the WHO and World Bank have asked for $50 billion in new financing for preparedness and vaccine equity activities in lower income settings. So, there's some of these commitments being made, these targets being set, but how that's actually playing out on the ground, what the actual needs are in terms of the communities, really needs to be known, and obviously is changing week to week with this pandemic. So what nurses are seeing and what midwives are seeing in their work, in their conversations with communities is going to be extremely important for these policies and this financing to actually have the optimal impact. And so really that is why we're doing this. We're doing this so policymakers, programs can be better informed by health workers' experiences. And to illustrate the impact of that, I'm going to play a video of just a few weeks ago of the Director General, the head of the World Health Organization, Dr. Tedros, was giving a briefing, an update about the pandemic. And this is what he led with. And one of our colleagues who's speaking later is referenced. So with that, I'll play the video.
In January of this year, a midwife from Uganda called Harriet Naiga joined our press conference to talk about her experience as a health worker during the pandemic. While vaccines were being rolled out in the wealthiest countries, Harriet was one of many health workers in Africa and around the world who was still waiting for her turn to be vaccinated. At the time, Uganda, like much of Africa, had relatively few cases of COVID-19. But starting in May of this year, Uganda experienced a surge in cases and deaths as variants tore through a largely unvaccinated population. This morning, Harriet sent us this email. Steve the second. The situation was tough.
I think, unfortunately, Vince, we might have lost the sound on Dr. Tedros. But I just wanted to say, and we can send this link, it's so amazing that one of our Nightingale Challenge participants, Harriet, was being heard by Dr. Tedros at the WHO. And we cannot thank you for your support to the Nursing Now Challenge as well, Vince, in seeing just what the power and potential there is in actually the nursing and midwifery community globally. So I'm sorry about that link, but I'm sure we can...
Yeah, no problem. I didn't know. I heard it on my end, so I didn't know that it stopped. So I appreciate you letting me know. Yeah. And yes, I mean, and we will hear from Harriet later today. So so that's just an illustration, though. Just sharing her story, as simple as sharing the story with policymakers, it was really important, not just for understanding, with the policymakers understood the situation of the supply in Uganda, but understanding in particular where it was getting with the health workforce was really important to know. And Dr. Tedros felt like it was needed to be the lead-in to tell the broader story of where the vaccine wasn't getting and where it was. So so it's a great, so this is why we're doing this, and this is our challenge for this next month. And so the challenge is really how can you utilize your personal experience, and this can be interacting with patients and colleagues. It could also be interacting with your own friends and family and community. It could be your own going through your own journey in understanding the vaccine. But how can that experience inspire nursing and midwifery leadership in advocating for vaccine equity, that all communities have equal access to vaccine, as well as acceptance of vaccines globally, or in your country or community. And so what's the process? The process is really just tell us, write up how you would answer that challenge question. There's a little there on the Nursing Now Challenge website. It has all of the directions, including all of the content here, that provides a little bit more context of how you can frame your answer to the question. But we really want creative ideas. We really want you to put it in your own words as to how you would utilize your own story, and what you would like to do in your community or globally in terms of advocating for vaccines and immunization.
That's brilliant. That's brilliant, Vince. And I can't wait to read some of the stories. I think we're going to be blown away. And I think if the next person up is going to give us some real fantastic insight now into how to become a brilliant storyteller. So no pressure, Pedro.
Right. So I will cue that up just to say that the winners of the challenge are going to receive a 5-week professional development course led by our next guest, which is Pedro Storchich, and the opportunity to share your story during the ICN Congress, which the International Congress of Nurses, on November 2nd through 4th, and $1,000 to develop your activity, prize money, and registration to the ICN Congress, which is a lot of great material that will be shared there. And so, you'll be, those who selected will have to agree to 3 to 4 hours the training per week, provide a little update for us on how it's going by January, and share your experience with other Nursing Now Challenge community. And so to apply that, go to the Nursing Now Challenge website. We'll send these slides around with all of the links, and you send it to this email here, info@nursingnow.global. The deadline is September 10th, and we'll notify the winners the week after that. Okay, well, with that, I'm going to hand it over to Pedja to tell us a little bit more about what the training entails, and to kick us off our discussion with the nurses and midwives. Okay.
And thanks again, Vince. And I do just want to say, you know, we are so delighted that you've partnered with us on this, and this is a fantastic opportunity and a very generous offer to the winners. So thanks again, Vince. It means such a lot to us all.
Thank you, Lisa. Thank you so much. Okay, Pedro, over to you.
That's great. I just want to check if people can see my screen just for a second, if the slides are on.
We've just got a dark screen at the moment, Pedro.
Okay, I hope it's coming in a second. Let's see if I can do anything about it. But in the meantime, I think it's safe to say good morning, good afternoon, good evening on this call, like, because it seems like we're covering all the edges of the world. And so first of all, like, let me thank Vince and Professor Pratt for putting a little bit of expectation what I'm going to do, but also to giving me this opportunity to participate in this and actually to contribute to the work that you're all doing. My name is Pedro Storchich, and I'm Executive Director of People Power Health, and also an instructor and a fellow at the Harvard School of Public Health, where I actually teach the course called Narrative Leadership, which is the topic that we're going to discuss today, and kind of like how storytelling is important in the context of leading and in the context of changing some of the circumstances that we address. So without further ado, I wanna probably start, and I'm gonna try to share my slides again to see if it's going to work this time. Is it black screen again, or it's different right now?
It's just the black screen.
Okay, what about now? Do we see?
Brilliant.
There we go. Well, right on time. So, it would be unfair to talk about storytelling without sharing a little bit of my story. So I was born and raised in Yugoslavia, actually, at the time, but lived throughout the period that was happening in the Balkans, where I always joke that I've changed 4 countries without moving, because it was Yugoslavia first, then it changed into another Yugoslavia, another version of it, and then Serbia and Montenegro, and then eventually Serbia. So 4 passports without actually leaving the country. And, I was lucky at the time to be, as I said, like old enough not to be drafted for war and pick up from the streets, which was happening for a lot of my friends who are a little older, but kind of like old enough to understand what's going on around me and what's the impact of the conflict and the war that was happening around us. And, part of that experience was also at the time, there was a huge epidemic of HIV/AIDS in Eastern Europe. And as a young person, I was in high school. We felt like the nobody was doing anything about it. It was just happening under the radar. And we felt this urge to do something about it. And we started doing peer education and kind of like going into communities. And, interestingly enough, because it was such an important topic for young people, despite the fact that government didn't care about it, nobody actually invested anything in it. We ended up with 12,000 volunteers, 12 offices across the country, and a tremendous impact that, was just, you can see in every place where we go. What was interesting about it, it was also zero budget, So I've learned a lot about how much you can do if you do have people power, and if you do have like people who are willing to step up and lead despite the circumstances that they might be part of. But at what was interesting about it as I was engaging into the medical school, what was happening is that, my professors there was telling me, I remember vividly one of my professors, he was a surgeon, and because there was a lack and shortage of doctors, we would, even in students, start practicing stuff and getting into the operating room. And he said, like, you're going to be a great surgeon, you're skillful with your hands. You just need to stop wasting your time on that public health stuff that you're doing. And it was really interesting because it was such a tension for me, because for me, medicine was about healing, was about doing that community work, was about actually engaging with people around you. Because I grew up in a big family, and I think that determined my understanding of the world. But it was also at the age of 6 where, I was playing in my backyard of my grandmother's house, and got into the house, and across the room, my father was sitting on a couch and he was completely white and covered in sweat. And I didn't know what was going because I was 7 years old. I only heard him whisper, "I'm suffocating. I cannot breathe." So as you can imagine, a 7-year-old Pedja was looking at his dad and something was happening to him. And I didn't know what to do. I just paralyzed, freeze, then run out of the room, call my uncle Raka, who was a police officer. He was a big guy. And I remember him shouting, "We need a doctor, we need a nurse, we need someone to help here," because my father was having a heart attack. And the reality was my family was big. We had like 40 people maybe in that backyard of my grandmother's house, not a single nurse, not a single doctor. Because we were, even in socialist, Yugoslavia at the time, you need to get, in order to get to the medical school or a nursing school, you needed to be from a certain family, not a poor family that mine was. So in Pedja's head, there was this connection between, to save your family, that means going into medicine, to become a doctor, that's what you do. And interestingly enough, later on when I started medical school and started doing the public health work and the community work, I've learned that the reason my father had a heart attack was because he was smoking 2 packs a day. There was no social support. There was no that public health community infrastructure to support him to get out of that. And I promised to myself that the medicine that I will practice is going to be the community medicine and the work that entailed, yes, working with patients, but also working with communities that we serve, making sure that we do get the prevention efforts out and really, really leading in the space that is just beyond the hospital wall. And I know, honestly, like my experience these days, because that's what I'm doing, that it's not coming, unfortunately, from my fellow physicians. Most of that work is coming from nurses and midwives and that's why this opportunity to work with all of you to kind of like enable you to tell the stories is a really tremendous gift to myself as well, because it's such a line with the values that I hold dear and the things that I believe are important. So, but that's enough about me. What we're going to do in the program itself, storytelling is a really interesting thing, because we think about storytelling as, oh, we tell stories, but in reality, it's a leadership skill. It's a skill that is required to enable others to, accept responsibility in the times of uncertainty. And guess what? Like last year and COVID-19 is a big time of uncertainty. We don't know what is going on. The things are constantly changing. And that is the moment that require leadership. Like it's not the moment where everything is okay. Nobody will ask like, who is in charge here? It's actually when we face uncertainties that we do those types of things. And there's a particular model of leadership that is different than the hierarchical structure that is needed in communities. It's interdependent leadership model. We call it like a snowflake, where basically you work with people to enable them to do the work together with you and not just do the work for them. And in order to do that, in healthcare, there are 2 pieces of how people join any action, in general. Like on one side of things, they need to understand why things are working as they are. And that's the head, that's the logic, that's the strategy of certain things. It's basically the answer of how certain things are going on. And we're really good in medicine of explaining that. Well, most of the time, sometimes that is, but most of the time we are actually focused on really helping people understand the logic of things and helping them understand what's going on in their body or how they can, or what we can do about it. The second part of understanding that is equally important is the work of the heart, emotional understanding of certain things. And that is where the narrative and storytelling is the language for. So if you think about the strategy being the head and the narrative being the heart, in order to engage the heart and emotions, you cannot engage them with numbers and data. You need to engage them. And the only way to engage them is with stories and with narratives that we can tell to each other. The good thing is that only when we have 2 of them, that's when people decide to act. And that's the model that we all kind of like can think about, is like, in order to get to the action, we need to engage both people's head and help them understand things, but also their hearts. And to engage their hearts, we need to do it through stories. Unfortunately, in modern medicine and kind of like the way it is taught, most of the efforts are to help us understand the logic, not enough efforts to actually enable us as health professionals to use the stories and the narratives. So in the particular, program that we're going to do with the people and the nurses and midwives who are going to be selected, we are going to teach the particular practice of public narrative, which will enable you to tell the story of self, which is about what is your story and why it's important for you to do this work, the story of us, the stories of communities that you are part of, and then the story of now, which is basically why it's important to do those things right now. One other thing that I want to give you as a warning, those who start the program, the skill of storytelling is the skill that you learn through doing it. Like, you're not going to learn to ride a bike by watching a video on bicycology. That's not going to help. The way you learn it, you need to get on a bike, try it on, see what happened. And usually the first thing that happens, you fall, unless you have the training wheels, you have the support. And that's exactly what we're going to do with that group, is to provide that scaffolding and the training wheels so you can learn a new skill without necessarily falling. But it will require a lot of engagement on your end. There's a journey, and we're going to share these slides so you can take, we're going to, through weeks, we're going to practice and learn more and more skills related to how you tell your story, which will be finalized in a narrative that you will be able to share at the conference, but also at the different other places. And there are 3 training elements to do that. There's a Ed app that we will use for micro learning. It's basically on your mobile. You can do it on the time that you have. So it's super simple and easy to use. There are live sessions where we're going to practice together. They're happening every week. And then there is coaching and practice, to get that story polished and really, really good. And the beautiful thing about it is once you learn how to do storytelling, you will see it's the skill that you will not, it's going to be really difficult to shake that off, because you're going to see opportunities to use it in different moments and in different circumstances that you might face. So with that, I know we want to hear some stories today from our panelists, and I'm going to hopefully facilitate a little bit of that in terms of asking some questions. But before we go there, I wanted to invite Dr. Emily to talk a little bit about, from the WHO perspective, why this is so important and why nurses and midwives are so important for this particular moment in time and what we can do about it. So without further ado, I will stop sharing my slides and pass it on to you, Emily.
Brilliant, Pedro. Thank you so much. And I'd just like to say, Emily, thank you so much for being with us today. And I'm sure people probably know, but you work in the Chief Nursing Officer for the WHO, and she listens to you, and you have brilliant engagement with us. So we're really blessed to have you with us today. Thanks again, Emily.
Oh, it's a real pleasure to be here, Lisa. I just want to say I've learned a new word today, bicycology. I've never heard of that before. It's a great word. I'm going to practice my bicycology. But yes, it's really great to be here. And I'm sorry that Elizabeth isn't able to join us today, but she did send her good wishes. She's a massive fan of the Nursing Now campaign and all the work that you're doing. And I think she's been on many of the seminars and webinars before. So apologies that she's not with us today. But we're going to talk about vaccine equity, and I'm going to share some of the perspective of the World Health Organization with you all. And I think that some of these messages will not be a surprise to you. So since Margaret Keenan, a 91-year-old British citizen, received her first vaccine on the 8th of December last year in a city called Coventry in the UK, 4.4 billion doses of vaccine have been administered globally. The WHO has spoken daily about the need to prioritize the vaccination of healthcare workers and the most vulnerable in every country. They've talked about the need for collaboration, international sharing of resources, and a global commitment to ensure that targets around vaccinations are met. So this is information that you are already familiar with. You've heard it before many times and in many arenas. So in the news, in your social media, your own networks, and in your own organizations. But as we continue to see rising numbers of COVID infection, particularly in low and middle income countries, it's really clear now that as nurses and midwives in every country, our role in promoting vaccine equity and acceptance is absolutely vital. So last year was designated the year of the nurse and the midwife. This year, it's the year of the health and care worker. The work of nurses and midwives has been more visible, better understood, and more respected within our communities than ever before. And this gives us an opportunity to be seen as trusted sources of information. And where there is misinformation around vaccines, we have a responsibility to provide accurate, evidence-based, and honest information around safety and risk. So our work is nowhere near done. Shockingly, despite the administration of 4.4 billion doses of vaccine, 73% of those doses have been administered in just 10 countries, just 10. There is less than 2% of vaccine coverage in Africa. The global failure to share vaccine equitably is taking its toll on some of the world's poorest and most vulnerable people. New variants of concern mean that the risks of infection have increased in all countries for people who are not yet protected by vaccination. But there are enough doses of vaccine globally to drive down transmission and save many lives if they go to the people who need them most around the world. Worldwide access to COVID-19 vaccine offers the best hope for slowing the coronavirus pandemic, saving lives, and securing a global economic recovery. Ensuring equitable access to vaccines requires extraordinary measures and global collaboration. Countries sharing doses through COVAX, which has now distributed 100 million doses of vaccine. Companies engaging with CTAP, the COVID-19 technology access tool, which facilitates free export of essential materials for vaccine manufacturing, sharing technology and manufacturing know-how, all critical in ensuring equitable access to vaccines. We know the global failure to share vaccines equitably is fueling the pandemic. Our targets are to vaccinate at least 10% of the population of every country by September. That's not far away. At least 40% by the end of the year, and 70% globally by the middle of next year. These are critical milestones if we must reach together to end the pandemic. COVID is increasingly becoming a disease of the unvaccinated. The majority of people that are becoming seriously ill or being hospitalized are unvaccinated. Most of them remain so either because they do not have access to vaccine, because they're hesitant, or because they've chosen not to have it. As some countries consider booster doses, people across the globe continue to desperately need their very first dose of the vaccine. So this can be addressed if the world chooses to address it. So last week, our Director General, Dr. Tedros, said the virus is evolving and it is not in the best interests of leaders just to focus on narrow nationalist goals when we live in an interconnected world and the virus is mutating quickly. In fact, strong national leadership would be to fully commit to vaccine equity and global solidarity, which would save lives and slow down variants. So for us as nurses and midwives in our day-to-day lives, what does this mean? Nursing and midwifery are evidence-based professions based in science. So we must use the scientific evidence in the work that we do. Where communities are hesitant, we must work to promote good communication, work with our local leaders and our trusted advocates at local level, and use local knowledge of the communities where we work. We must understand the cause of hesitancy, acknowledging and addressing concerns, and show our skills as leaders to support people to make wise decisions based on accurate data. Where people struggle to access vaccines because they live in remote locations or just can't get to a vaccine center, we must use our practical operational knowledge to establish solutions to reach our hard to reach communities, and we must lead by example. So we're going to hear now from our inspiring panelists who have led by example, shown leadership, and overcome huge challenges in their work to vaccinate our populations, and we're really proud of those. So enough of me, and we're going to start first of all by hearing from Belinda Abbott, a nurse in Australia. She's sent us a message by a video.
Under. My name is Belinda Abbott, and I'm a registered nurse and a fellow of the Australian College of Nursing. I'm currently a nurse leader within the COVID-19 response, supporting testing clinics, vaccination hubs, quarantine hotels, and the disaster management response for a large metropolitan health service within Brisbane, Australia. Australia is a diverse and magnificent country, well known for our wide open spaces, our beautiful beaches, our tropical rainforests, our sparse deserts, and our outback as well. Our geography also plays a major part with the social determinants of health within our community and within our country. And I'm going to talk to you about what these challenges are in terms of vaccine acceptance and equity, and how nurses in the front line of this pandemic is playing a vital role in vaccinating the country. I've been a nurse for over 20 years, and I'm proud to be a part of one of the 400,000 nurses in Australia, making us one of the single largest groups of health professionals, most trusted profession, and most widely and evenly distributed within Australia. I've seen firsthand not only working in metropolitan Brisbane, but I've also worked in Darwin in the Northern Territory and in Mount Isa in a remote part of Queensland. I've seen how nurses bridge the healthcare gap and how it benefits the Australian community with nurse-led models. Thousands of Aussie nurses have undertaken immunisation training, and in particular COVID vaccination training, and are currently working in primary healthcare, aged care, hospitals, rural and remote clinics, and just to name a few, to provide vaccinations to our community. Nurse-led vaccination hubs are an example of this, and our nursing workforce are flexible and responsive to the community and work collaboratively with other integrated healthcare team members to ensure and extend this coverage. Another example of responsiveness and access to healthcare is our Royal Flying Doctor Service that have both nurses and doctors leading the charge to reducing the access gap. And currently, they're running a community-led vaccination program to isolated and remote communities across Australia, thanks to the funding from the Commonwealth Government and also with close coordination with primary health networks, Aboriginal medical services, local hospital health services, and also state governments. To date, over 8,000 COVID-19 vaccinations have been given in remote communities across Australia. The aim is to vaccinate 80,000 by the end of the year, and I'm sure that the RFDS will be able to achieve that. Our nation is culturally and linguistically diverse through diversity of religion, spirituality, sexuality, culture, gender, socioeconomic background, geographic spread, and healthcare needs. It's the important and early collaboration and communication with these communities and the prioritisation of these communities that are at the forefront of early vaccine delivery, and obviously the planning that's required around this. Australia has done extremely well with the COVID response. However, there is still an element of vaccine hesitancy. Some of the Australian community are concerned about the vaccine and deserve the reassurance, the right communication, and the right information for informed decision making. We have seen, however, an increase in intention to be vaccinated and also an increase in the vaccination uptake. And this has been specifically around during times of lockdown and also increased infection rates. Already, 12.8 million vaccinations have been administered in Australia since the 21st of February this year. Over 8 million have had their first vaccine dose and over 4 million with their second vaccine dose. With a population of nearly 26 million, we haven't done too bad, and we obviously still have a way to go. Together with the government, our integrated healthcare professional community, our First Nations people, our culturally and linguistically diverse community, and our U-Butte nursing workforce, we'll work through together to overcome these challenges. So I'd like to thank you for giving me the opportunity to talk to you today. As you can see, the beautiful Brisbane landscape is in the background. This is where I currently live. And also the 2032 Olympic Games. So hopefully by then I'll get to meet a few of you and you'll be able to travel and visit us in Australia. Lovely to talk to you all. Have a wonderful day and take care. Thank you.
Wow, that was wonderful. So in terms of kind of like the way we're gonna kind of like facilitate this conversation now with the panel. First of all, I just want to invite all the panelists to, if possible, get on a screen so we can see them, like to turn on their cameras, of course, if it's appropriate and okay with you, so we can see you. Hi. And the first question, and then the other thing is that when you are when you start speaking, feel free to introduce yourself at that moment as well, so the group will know. We're not going to go around and introduce everybody, but as you are answering some of the questions and we're having a discussion, feel free to start with a short introduction about who you are, where you're coming from, and how why you're here and what's your connection to this work. The first question that Vince has asked us to think about is what are the impressions of the level of prioritization for nurses and midwives in the COVID vaccine rollout in your country or community? And what is your impression how the nurses and midwives responded to that? Like, what was the response within your professional community? And since we have Harriet here, I want to start with you by asking you that question, because I was curious, at least we didn't hear what caught the attention of the WHO Director General in the message that you shared. And yeah, feel free to introduce yourself and tell a little bit about that story that end up in such a powerful place when it comes to the COVID-19 response.
Thank you very much for giving me this opportunity. My name is Nigel Harriet, and I'm a midwife from Uganda, the founding director of Midwife-Led Community Transformation, MILCOT, which is a community-based organization that focuses on bridging the gap that exists between the midwife and the local community through provision of sexual reproductive health and rights to marginalized adolescents and young adults. I'm a young champion with nursing now, and I'm really glad to be on this panel. I'm so passionate about projecting my voice for impact. I feel so happy to see my voice creating a change. And what compelled me to send an email to WHO is the result of what I was seeing in my community around me and around vaccine acceptance. The fact that I had taken the vaccine and it wasn't easy for me, and yet I'm a health worker. So I also put that in mind, that if I'm a health worker, and at first it took me some time to contemplate, to think about it, to read more. How about a person who doesn't have any information about health? What does he need? What does she need? So I had to say that people are responding, but because there is no solution and they are now walking to work, because we are trusting that the vaccine is the solution now, it is the one to save us, and it is available. Let's work. But we have to take responsible of our lives. And if everyone can be responsible and take the vaccine and go for the vaccine, we shall be well. And
right.
once that message was
can I ask you a question? I'm just curious about, sorry to interrupt you, I'm curious about when you say that people being responsible, what have you seen on the ground? Can you tell us about the example of somebody who really inspired you to say, oh, this person is actually really stepping up, and I want to lift that up as a story for others? Like,
I'll say that the impact has been amazing. With an example, I called my friend who is a doctor, and I asked her, have you been vaccinated? I got my first vaccine and I'm yet to go for the second. How about you? And she said, I'm still waiting. I'm still thinking about it. And when this message came from WHO, I saw messages coming, including her. And she said, this is great. I think I should go for the vaccine.
That's really cool. Wow.
I think I should go for the vaccine. And then also among my people, many of them were saying, some of them were saying, be careful as you go for the vaccine. But right now, some of them have been vaccinated because of my message.
Yeah.
Because of my message.
Yeah.
And I want to share the tools that I have used and I'm using. However, I apply these tools not expecting quick results. It takes some time. In one of the books of leadership, there is that as leaders, we have to use persuasive language. And being persuasive, you have to be with evidence, and you have to be with a compelling story.
Yeah.
Without evidence and a compelling story, it is hard to persuade someone. And this has been running across my mind. And I'm asking myself that if all of us nurses and midwives can be leaders who have that tongue that can persuade, I think we can win the population to go for the vaccination. By showing them the good things that are in the vaccine. One of my team members here has not gone for the vaccine, and she's here. She doesn't mind me talking about her. I asked her that I have shared with you my story several times. What is that thing that is still resisting you to go for the vaccination? And she said that it's like we need more information to come on ground, more general information to come down to the communities. And I told her, but the government and Ministry of Health, I'm looking here because there is a TV where we always get the information while we are here in the office. And I told her, we are always having the Ministry of Health providing us with enough information. It has done its part. What are you waiting for? And she was telling me, TV is not enough. For us, we are laymen. We are, we need people to come on ground to teach us what are the good things in the vaccine and what can we expect as the side effects. So that is where I want to end my story by saying that we need to provide more information, especially on the grassroots, because that is where the consumers are. They need us physically. They need to hear our stories. I think us who have been vaccinated need to come up more so that we can be seen, to tell the people, to show the people how we are smiling, how we are happy, and to tell them we shall have a healthy future when we are vaccinated. Thank you very much.
That's wonderful, Harriet, and it's such a really great example how the voice, your voice that you raised, could go up and then come back down in a way, in a different way, and that was a beautiful story about your friend. I wanna shift us a little bit to a different part of the world and invite Rita to talk a little bit about her experience. And I know you might have some slides, but you can decide if you want to show them or just share your story and the experience. And I also like to add to the question a little bit. if you can also share about what do you think are the needs of the healthcare workers as well as you're sharing.
Good afternoon. I am Rita EA from Lebanon. I'm a registered nurse. I'm also handling a master's degree in health management. I'm a winner in Nursing Now Challenge with Jaya Mental Health, and I'm very happy to share with you our experience in Lebanon. I thank Andrea. She will share my slides if possible. Thank you, Andrea. So in Lebanon, we are having we are having practically a free vaccination possibility. Next, we can register in the official COVAX platform, but despite all this effort, we're still having only 14% of our population vaccinated. Next. So since we're still at this level, nurses in my community were asking why Lebanese population does not take this vaccination. It's free and we can get it near our houses. Next. So what we did in our population as nurses, we ran a little issue to know what are the problems. There is vaccine rejection, mistrust in the system. We have a lot of problems actually in Lebanon. We have people who are saying we don't know the future effects. We prefer the natural immunity. So facing all those problems, we made as community of nurses a task force. Next, please. So what we did in this task force, first of all, we were at the eye of the storm of the COVID pandemic in Lebanon. Nurses and midwives were the first to be introduced near of the patient. We were seeing our parents, we were seeing our patient dying from COVID. We was overwhelmed by this pandemic, and we know that this for now is COVID is the disease of unvaccinated person. So we decide to take the hand and to do something to change. And since we are the most trusted source of information for the patients and for their parents, what we did practically next, we did this task force. We launched webinars via Facebook. Since Facebook is very accessible in Lebanon for people, we communicated with infectious disease specialists. They were speaking Arabic to get to the population in Lebanon. They were explaining, we did 4 webinars to all the population to know what is the importance of the vaccine and how we can be secure when we get the vaccine. The next step we did at our community, first in our hospital, we register all employees in the official platform and we help them to register their parents also and to choose the location that is near their houses. And when the nurse go and get her vaccine, she took a picture, she published on her social media, and we were celebrating this vaccination. And the same day she was coming at work, since when she come at work, she's fine, she has a good health, so the others are motivated to go and get their vaccination. Next, what we did also, we was volunteering with the Lebanese Red Cross for the vaccination campaign. So when the people see that their neighbor as nurse is going for free with the Lebanese Red Cross to give the population the vaccination, they were motivated. Oh, my neighbor is going, so I can go also. We worked also with the on-premises delivery mobile vaccination to go to the people who are with limited mobility and give them vaccination at home. There are also the fairly elderly persons with disability. We was delivering them the vaccine at home. Next. Also, with midwives, we was working on education for pregnant women. Our hospital, Abu Jawdi Hospital in Lebanon, we have a program for pregnant women. Before they deliver, they come to the facility, and we was educating them about all stuff about a pregnant woman and the baby and all this. What we introduce with the early midwives, career midwives, the fresh graduate midwives who are very excited to this program, they introduce the importance of the COVID-19 vaccine. And in order to have the pregnant women who are really like stressed, it's a new vaccine, how can I take it? So they were listening actively to those pregnant women and responding based on the evidence base that we have, based on the research that nowadays we have. And we were telling them what is for, what is not for, so they can take a clear and based on evidence decision. And we can say that midwives were excellent, brilliant also. They get the COVID-19 vaccine to a majority of pregnant women who are very happy to have this vaccine. Next, also we worked with vulnerable patients in the hemodialysis department. We know that the hemodialysis patients are very vulnerable. They sit 4 hours in the hospital. There are the one near the other. The social distancing is not always respected. Sometimes they put off their mask to eat when they are purifying their blood. So this is really a big issue with COVID. So what the community of nurses in hemodialysis did, first of all, they began to speak about the importance of the vaccine. Then they show their patients with their cell phones that they get their vaccine. In the next step, there was choosing one champion, a champion patient. He was helping the nurses to convince his colleague patient to get their vaccine. And really, this patient champion was a brilliant idea of one nurse in the hemodialysis department, because this patient convinced the other patient more than nurses. The role of nurses here was only to give trust and evidence-based to the patient when they ask difficult questions. So at every level, the nurses were very involved to get the patient vaccinated. Next. Practically, we believe as nurses and midwives in the vaccine equity, because it's a moral, strategic, and especially in Lebanon, with our economic situation, it is an economic imperative. The health system is overwhelmed, the medication are not available. Since we have this issue of vaccination against COVID, it's very important that all the population gets vaccinated. And also, we believe that it's very important to introduce the COVID-19 vaccination in the primary healthcare network. Since today at our Lebanon, it is not integrated like other vaccine in the primary healthcare network. This enables access to more people. And of course, the voicelessness, when we tried this issue in our hospital, we was also collaborating with our colleagues in other hospitals. We was sharing our experience and learning from other nurses in other hospitals. So this can lead to major changes. And of course, all nurses can use evidence-based practice to raise the vaccination rate, because all people can bargain, ask, but what they cannot say no to is evidence-based. When they see articles, research that are the proof in the hand of a nurse, so they cannot say no. And I want to thank you for this opportunity to share the Lebanese experience. Thank you.
Thank you, Rita, so much. This was great. And in the chat, just for you to know, there are a couple of people commenting how they were really inspired by some of the things that you did.
Thank you.
By the way, I invite people to ask questions in the chat. If you do have questions, there will be some time towards the end to answer them and to invite our panelists to answer them. Shifting gears a little bit and moving to Malawi, I want to invite Rashid to offer his comment and experience with the both the kind of like a treatment and engagement of nurses and midwives in the COVID-19 response, but also, as I said before, like what are the things that you're seeing that are being challenges and things and opportunities for that community to be even more supported. You're muted.
Yeah, sorry for that. Thank you so much. I'm Rashid Manganda from Malawi, nurse midwife. I currently work at Palombe District Hospital. I also coordinate maternal and child health program in the district. In addition to that, I work as COVID-19 surveillance and response nurse in the district. I'm delighted to be part of this webinar. I think I'm the first male panelist, if not the only one. So I'm so much delighted to be given this opportunity. I'll start with the challenges that Malawi is facing to improve the acceptance of COVID-19 vaccine. First of all, the erratic supply of COVID-19 vaccine is the most challenge that is hindering Malawi to get more people vaccinated. Why am I saying this? It is not the availability of vaccine alone, rather the unavailability of vaccine alone that is limiting people to get vaccinated, but the effect of unavailability of vaccine in the vaccination center is the one that is worrisome fact. For example, when the vaccine is available in Malawi, people flock to the vaccination centers to get the vaccine. These people that I'm talking about, they are not sure whether to get vaccinated or not. I can say they don't even want to get the vaccine. But when they've decided to get the vaccine that day and they have gone to the vaccination center and they don't get the vaccine, they go back and they'll never return for the vaccination. And they tell their friends or families that there's no vaccine at the vaccination center. So they opt not to come again for the vaccine. This is very challenging. As I'm saying right now, only 1.9% of Malawian population is fully vaccinated. Why? Because we have been having intermittent supply of COVID-19 vaccine. The other challenge is health worker resistance in getting COVID-19 vaccine. There are some few health workers that I know personally that are resisting to get COVID-19 vaccine because of religious beliefs. Some asking them, they respond, I'm not done yet bearing children. What does that mean? They believe if they get the vaccine, they will not conceive again. So imagine this information is going to the community. The lay people who do not have enough information on this, it is giving much of the problem in the vaccine rollout. So vaccine health worker resistance is also a big challenge here in Malawi. The other challenge is failure to involve local leaders in the communities. Since vaccine rollout started, we health workers, we only go there with the information to sensitize the community, to give the vaccine, but we never involved the local leaders. Say the local leaders be on the forefront, sensitizing the people in the community, because these people are the most trusted by the people of the community. So if we engage them, involve them, we can improve the acceptance of COVID-19 vaccine here in Malawi. So in terms of prioritization and utilization of nurses and midwives in Malawi, much impressed with how nurses are utilized and prioritized in terms of COVID-19 vaccine rollout. Nurses are entrusted with responsibility and are on the forefront, explaining the myths and misconceptions which are surrounding COVID-19 vaccine through health talks on COVID-19 vaccine given in all strategic areas in all hospital settings. For example, nurses are the ones that meet a lot of people at the hospital settings and any other healthcare workers. So they utilize this opportunity to give out information on COVID-19 vaccine. For example, at family planning area, at antenatal area, in OPD area, even in outreach clinics, they give out the information on COVID-19. In addition to that, a good number of nurses have been trained in COVID-19 vaccine here in Malawi. They are also on the forefront training other healthcare workers. So I think it's a good thing for the nurses to be on the forefront, training the clinicians, training other community healthcare workers, and the like. Furthermore, senior nurses are also involved in decision-making surrounding COVID-19 vaccine issues in the district. We have our, whom we call district nursing officer, who is the leader of nurses in the district, is very active in COVID-19 vaccine issues and other issues related to COVID-19 vaccine. And she is very much involved in decision-making when issues concerning COVID-19 vaccine arise. So it's very much important for us nurses. Finally, nurses are also the ones that are on the forefront, giving out the vaccine to people in the communities. As I said, these nurses were trained to give vaccines, and also they are training other people to be giving out vaccine. For example, the first dose of COVID-19 vaccine to be given out here in Malawi was given by a nurse to our president here in Malawi, which is a sign that nurses are really prioritized in COVID-19 vaccine here in Malawi. So I think it's a positive thing to us as nurses. Even though these nurses are prioritized and utilized, and they are committed to give education on COVID-19 vaccine, they are committed to give vaccine, they are training others, but some, they haven't walked the talk. As I said, some nurses are still now resisting to get COVID-19 vaccine. Yes, they are vaccinating others, but themselves, they do not want to get COVID-19 vaccine, which is very challenging. Thank you so much. That's all I had to share today.
Thank you, Rashid. I did have a question for you. I'm just curious. It seems like you've been doing a lot, and you personally was active, and you are active in kind of like making this happening. What is motivating you? Like, what's the driver for you to do this work, to go above and beyond, and really motivate others? I'm curious.
Okay, thank you so much for the question. Me personally, I feel COVID-19 vaccine is the only way out for us to resume to normal. As I'm talking right now, a lot of services are scrambling here in Malawi. We cannot give outreach services because people are chased at outreach service. Because community members, they think if we bring family planning service to them, it is COVID-19 vaccine, not family planning. So a lot of services, health services are not working out well. So personally, I want to end this COVID-19 vaccine so as to improve health in general here in Malawi.
That's wonderful. Yeah. Well, it is way beyond just the one particular thing. It's really affecting all the other things, and really well said. Okay, moving again, like we are kind of like, I feel like we're traveling the world. This time, a little closer to where I am. I'm in Boston. So I want to invite Amy to share about the experience in the United States and what's happening here, and how nurses are engaged here. Amy, I think you're in New York. Is that right?
Hi, good morning. I am in New York. Thank you all for having me here today. I think that it's heartbreaking, honestly, to hear the stories in other nations. So Harriet and Rashid and these stories about healthcare workers not having access to the vaccine. In the US, we do have quite good access to the vaccine. I think that some of the challenges we face here in the US are misinformation, spreading of false information. I'm very lucky. I work at New York Presbyterian, Weill Cornell in New York City. We are the #1 hospital in New York, so I have so many access to so many valuable resources, but I recognize that not all institutions and areas have access to these same resources. So I think it's our responsibility to increase our community-based outreach, reach individuals of all educational levels and backgrounds. And as an individual who was raised in a low-income community, I would love to create a community-based outreach program and education materials to share with those who don't have access. In New York, the pandemic opened our eyes to the disadvantages that those face. So one example, back in 2020, when school was made remotely, we noticed that many children at home didn't have access to Wi-Fi, causing a disadvantage for them. So last week, I spoke with another individual in my community who opted not to take the COVID vaccine, noting it cost too much money. So when I informed her that it's actually free, and currently companies such as Lyft and Uber are providing free rides to and from vaccination sites, she changed her mind. So I think that reaching those communities, listening to their concerns, and providing accurate information will definitely increase acceptance and adherence. For me, the COVID vaccine was my Christmas miracle, I call it, because I actually received the call on Christmas Eve on my unit at Weill Cornell that the vaccine was made available to us nurses. I admired our leadership team as they gave it to us first, nurses on the front lines. Everybody really took a step back there to protect us. The other issue that we faced, in addition to low-income communities not having those educational materials, are those who do have the education and have chosen not to accept the vaccine. So for those who have been waiting for it to be FDA approved. Luckily, Pfizer did that yesterday. So I do have hope that that will increase adherence. And I would also challenge those who have chosen not to accept the vaccine that we have adjusted our lives once before throughout the pandemic, and we can definitely do it once again by making vaccination a routine thing. We've entered an era where Zoom no longer defines how fast something travels, but rather it's a program that allows us to connect from inside of our homes and has brought us together today, a time where parents have taken on a new role of homeschooling their children, and a time where we have really relied on our nurses to hold our communities together. So I thank my colleagues here today for sharing their voices and sharing their stories. And I think that together with Nursing Now, we can make vaccination more widely accepted and improve adherence. So thank you for having me.
Wonderful. Thank you, Amy. And yes, it is really interesting how some of the challenges are quite the same, despite the fact that there's availability in the United States. It's kind of like some of the hesitancy is coming from maybe the same places of insecurities around these things. I wanna shift us now to Manita. It's kind of like in Nepal. Manita, I know you were part of the process there to do the COVID vaccination, and just curious to hear your perspective and your experience with it as well.
Namaste, I'm Manita Morjan from Nepal. Everyone. Namaste. It's my first attempt to take part in this program, and I'm too much excited as well as a little bit nervous also because it's my first attempt. And during the COVID vaccine, I have little experience only. I have joined since 4 months in COVID vaccine, and I have not much more experience in the vaccine. Just during the vaccine, we face a little bit problem, like people misbehave us and they talk. They misbehave during the vaccines. They physically touch also. and there is no taken, the government do not take any action when we we just try to make understand them, but they do not take any actions. We face they also overcrowded, as Nepal is developing countries. People are unknown about the vaccine. They refuse to take also the vaccine because they thought the people, if we have vaccine, then it will die, or they can't go back to their normal activities also. So there is much more misconception in our countries. And beyond this, people who do not have their citizenship, they are not having this vaccine also, that I feel too much sorry. And again, that orphan people also not having this vaccine, they feel trouble to in the particular area destination. So again, the government is trying best to have all the vaccines, and that's most, sir. And we are trying best to get all the vaccines by giving through knowledge through social media, and we are helping from the higher level also. Like I'm joining the 200 municipalities, and through them our team is try our best to have the vaccine for all peoples. Thank you, sir.
Thank you. Well, that was wonderful, and thanks for sharing about your experience doing it and being part of that process. You know, I know we are. I think we are almost on time, but we have two more voices to hear here before we go to Vince and the team to address some of the questions. So, Stephen, I wanted to invite you to share a little bit about your experience, and also feel free to introduce yourself as well.
All right, hello everyone. Greetings from Ghana. I am Stefan Osei. I am a final year nursing student at University of Ghana. And to share a bit of background in Ghana, currently only 1.3% of Ghanaian citizens are fully vaccinated. And I think Malawi is a bit ahead of us. But then that sort of tells the story of Africa. I remember the earlier speaker saying, well, Africa has the least coverage. And there is, we are being faced by a lot of challenges. There is the issue of vaccine availability. So currently in Ghana, there are a lot of politics surrounding vaccine availability, like getting vaccines, purchasing them and making them available to the citizens for free. And there's also a bit of misinformation here and there. But nurses have really taken up the challenge here in Ghana. One nurse Gifty, she was supposed to join us today, but unfortunately she couldn't make it. She is literally shouting down misinformation in Ghana. I would like to share a picture of her article, if that is okay. And then as I'm doing that, yes, so vaccination in Ghana is something that nurses take, huge prominence in. It is heavily led by community health nurses, and it's just amazing how these community health nurses are coordinating vaccine clinics. You could see doctors actually working under community health nurses and researchers working under community health nurses. It is literally for them. They are championing the vaccination and all that. And to see other nurses like Nurse Gifty also literally go to the streets and the market and everything with her megaphone and then just spreading out the news. COVID is a disease for the unvaccinated. Get vaccinated. Vaccines won't kill you. It's not necessarily wiping out your race and etc. I wish she was here today to actually share a story, but then that is how Ghanaian nurses are taking up the challenge. We just hope that in the future, the politics surrounding vaccine goes down, that a lot of leaders realize that we need to protect our lives. And then we have much more available the availability of vaccine goes high. I'll also be sharing some pictures on the certain. I conducted a survey on vaccine acceptability here in Ghana, in my school, in my university, among health science students, and you realize that a lot of people were ready to accept the vaccine. Students, doctors, student nurses, allied health science students, etc., and they're even ready to recommend it. But then the issue is availability. So yes, going forward, hopefully we get to see more.
Thank you, Stephen. I've just shared your little picture of nurse, doing that megaphone thing. I think it's really like an amplifying the voice that is important. So shifting gears now to Adolphine, I think from Rwanda. So there you are. Wonderful. So if you can introduce yourself and then share a little bit about your experience as well.
Thank you for having me. My name is Adolphine Mwekatete. I'm from Rwanda, and I'm a nurse midwife, a registered nurse midwife. Currently, I work with Japaigo in a maternal, newborn, and child health program. I worked also in a hospital, in a teaching hospital for like 10 years ago, and I was privileged to support the Ministry of Health in providing COVID-19 vaccination. So like other country, in Rwanda, the vaccination started in March 2021, and the healthcare professionals were among primary beneficiaries. Nurses and midwives occupied the first place, and personally, I was very satisfied by this privilege given to nurses and midwives, because as we are frontline healthcare, we are at high risk. Each patient we receive is a potential candidate of COVID-19. That is why we really thank our government for providing that privilege to nurses and midwives, as well as other healthcare professionals. Like others said, we have challenges of acceptability of vaccination among nurses. Even myself, when I get vaccinated, the first dose, I reached to the work, and they said to me that today we are going to be vaccinated. I was not ready. I was not ready because I hadn't enough information. We hadn't enough information. I was breastfeeding a baby of 1 year, and I had that the COVID-19 vaccine is contraindicated in breastfeeding mothers. I didn't have enough evidence like other my colleagues, but it was like a dilemma to me, because I was thinking, if I lose this opportunity, maybe there will not be another opportunity. I went to my supervisor. She's also a midwife, and I explained to her my concern. She told me that she has read like 3 or 4 papers about the benefit of taking COVID-19 vaccine while breastfeeding, because the baby also benefit from the vaccine. I went to get the vaccine that day, and I took a picture for myself, and the picture was posted on my WhatsApp status. In the evening, I received many calls of my fellow midwives. Did you accept to get the vaccine? Are you sure you are still the same? And it was like I was giving testimony, and then I went to the second dose when the time came. And I think that this picture of mine changed the thinking of my colleagues and then they get the vaccine. Challenges here we were not prepared for the vaccine. We had not enough information at the beginning because there were many rumors, there were many myths about COVID, but we didn't get this information about the vaccine. But fortunately, for now, we had information from the Ministry of Health, from the other partners. They are delivering messages, and even in the health facility, in the morning staff meeting, they are doing a presentation so that to address those myths. That is why the acceptance of vaccine is increasing. The problem in our country is like the shortage. You can't imagine someone can ask you, can you tell me where I can buy the vaccine so that I get vaccinated also? Because we vaccinate people at high risk, and we call them per village. We don't call them come all for vaccination. We organize where there are vaccine, and then we call people. I think that more information is needed for the community, for the nurses, for our patients, so that it increases the vaccine acceptability and equity. Thank you.
Wow, thank you for sharing that story, and I really like the fact that one of the most important things in storytelling is also to tell the story as it is, and you really inspired me to think about that transformation, how you went from being kind of like a little, it's a scary thing, like should I do it or not, into yes, this is something that I want to do. And thanks for sharing that. Before we go to Vince and the Nursing Now team, I want to invite Dr. Emily to provide just reflection on, we've heard from all the panelists, like if you have any thoughts or reflection of what you've heard so far. Yeah.
Thanks, Pedro. Yeah, I think there's some themes, aren't there, that wherever we are in the world, people are anxious about the same things, because essentially COVID is affecting us all in similar ways. And I think when you start talking about why people are hesitant, even if you have been in a position where you've been offered a vaccine as a healthcare worker, I remember when I got mine, I wanted the information, I wanted to learn more about it, I wanted to be sure I was safe, I wanted to know that if my children should have it or not, and the information. So access to really good information is a common theme that we really need to embrace. And I was just literally about to paste another link into the chat box around WHO's guidance on pregnancy and breastfeeding and the COVID vaccine. And I would really reassure you that there are some really, really good guidance and information that's easy to understand. It's in different languages that you can share freely with people that you work with and people that you're talking to. But I think it's really important, and listening to what everybody is saying, is that we understand why people are hesitant. Why does it worry me? Why does it worry you? Everybody comes to this with their own personal experiences, and we've got to address those in order for people to be reassured about what they're having. But this really feels that it's not specific to countries, it's a problem across the world, and therefore it has a global solution. And I think this is why hearing from other countries and initiatives is so important. And just one final thing, I think the idea of just getting out your megaphone and standing in the middle of your town and shouting about why it's important is absolutely brilliant. And I really applaud people who can do that and really spread the word as advocates. Nurses and midwives, we have such a big role in that message, and I just have that wonderful vision of listening to it in every area. So yeah, it was great to hear those, but I think we share the same problems across the world.
Yeah, that's well said, and we just need to give them a bigger megaphone, yeah, that's right. Well, thanks everybody for sharing, and then I know we're gonna venture into Q&A section, and Vince, I will pass it on to you to lead that. And I want to thank everybody, and it was a real pleasure and gift to be a facilitator of this conversation and this exercise. So back to you, Vince.
Well, thanks. And I know that we're kind of near time, but I believe we've had a really great back and forth in the chat box, and I would continue to encourage folks to continue to message the last few minutes that we have here. I mean, the one question Christine raised that if anybody wants to address, we did talk about this a little bit, but there's, obviously a lot of perceptions among misperceptions among adults and youth about the vaccine. And I think especially this is being seen among younger populations, younger adult populations, and some in the youth as well. And so just curious if anybody on the panel has had a experience in speaking with a younger colleague as to misperceptions, and if you've had success with any of those.
Vince, it's Lisa here. I think one thing for us not to forget is how amazing nurses and midwives have been over the decades in encouraging women to vaccinate their babies against certain diseases, encouraging the uptake of the flu jab. And it strikes me there's another massive piece of work we need to get our heads together on, which is about what have we learned over the years and with COVID about what we need to do and how we do it well in terms of vaccinations, because the battle goes on. Even if the world were vaccinated with the COVID jab, we've got other vaccinations that are really need a lot of work in terms of greater uptake. So I think there's a bigger question here about what more do we need to do to support nurses and midwives to be able to confidently and competently encourage and enable their communities to get all of the vaccines that they need in order to prevent some dreadful diseases and life-limiting conditions. And I think there's success stories all along the way, that we could pick up and learn from. And I think there's similar successes with HIV prevention and Sheila Clow, our fantastic champion, and she was the co-chair of Nursing Now. She's got some amazing solutions around educating people about HIV and how to prevent it. So I think there's something bigger here that's looming that we ought to think about encapsulating as part of the next leg of this fascinating journey.
Yeah, I completely agree, Lisa, and I know that Rashid had mentioned that the impact that it was having on both other vaccinations, but also on other routine health services. And like you say, nurses and midwives have been in those conversations with families, with pregnant women, with children for many, many years. And those experiences really need to be shared as much as possible with the entire health workforce, with the health policy community, because we're facing a significant challenge currently with the COVID-19 vaccine rollout. But like you say, the impact of some of the misinformation or questions that folks are having and the impact that has will not just impact what's happening currently, but down the line. And so I think just what was shared today with Manita sharing the issue of non-citizens in Nepal not being able to get vaccinated, or Stephen sharing what nurses were doing what we're doing on the streets, and sharing what the impact that is having on their profession. And Adelphine really brought home that really powerful point of there needed to be some validation, safety validation on pregnancy and breastfeeding, and those studies have been done, and Dr. McWhirter shared that information from WHO. But it's understanding that there are questions, valid questions that people will continue to have, but those are not always readily apparent for health policy leaders. And so what nurses are hearing, what midwives are hearing from those they're working with, from their own colleagues, is extremely important. And so we hope to keep this conversation going. So we really encourage you all to send in your applications. But beyond this training, we want to keep raising this issue in every forum possible. And so love your ideas to continue to flow and continue this conversation. So I know we're a couple minutes over, but we really appreciate you all joining today, and look forward to continuing this this conversation and continuing to share experiences from around the world.
Fantastic. Thank you so much, everybody, and can't wait to see who the winners are and what we learn from that. Really appreciate everybody's involvement. Bye-bye.
Thank you.
Bye.
Bye.